But
Okay, we are back. This is Senate Health and Welfare on March 11th, and we're looking at the next draft, 4.2 of S285. And Jen, why don't you just go right ahead?
All right, Jennifer Carvey, Legislative Counsel, again for the record. So section, I'm just gonna go through the changes. I added a definition in section 1, thanks to some quick work to kind of cobble one together from some federal language, from Green Mountain Care Board and others. So this would add a definition saying, as used in this section, value-based payments means payments made pursuant to a healthcare payment model in which healthcare providers, including hospitals and physicians, are paid based on patient health outcomes, and in which healthcare providers are rewarded with incentive payments based on the quality of the healthcare services they deliver.
Terrific.
Does that work for everyone?
Yeah.
There were, there may be changes needed.
what page is that? 5?
That is on page 2 to 3.
Page 2.
All right, next change is on page 5. This is in section 2 on the healthcare delivery system transformation. And I incorporated a lot of the concepts that we had looked at in what had been subsection E, but instead of requiring a report and a funding analysis, it just says, in developing a plan for delivery system transformation pursuant to this section, the Green Mountain Care Board and the Director of Healthcare Reform and the Agency of Human Services shall consider the capacity of Vermont's community-based healthcare and social service providers to effectively implement the plan as it relates to community providers while providing the appropriate level of services to consumers. And then it keeps that same definition. But that works as sort of a middle ground to keep the idea out there,
Right.
without putting,
It really implies
Unnecessary.
next steps.
right, it's, right, but it also, I think, suggests not creating a plan for something that won't work in actuality.
We've seen that before.
All right, and then the other change is in, well, I took out that subsection E, I unhighlighted. In section 4, I took out the appropriation and the subsection A designator, so that's, so there's just the standalone language about the Health Information Exchange Steering Committee.
Wait,
Sorry,
on page 7, just before section 4, this is new. This.
yep, it's all new that we went through this morning.
Yeah.
Oh, this
right.
is the second I
And we congratulated you on putting
Yes,
splitting the money down the middle.
Yeah, it's a kind of suggestion.
I mean, the language, just the language is different, the
Okay.
suggested from AHS and Green Mountain Care Board.
but it was their consensus.
But so they did split the money.
Okay.
And the money's gonna change, you know that.
No, I know that. I was trying to figure something out for you. Okay, I'm sorry, I was behind it. A draft.
Yeah, so you'll see the changes in that one,
Okay.
what was new this, or what was new this morning. And then the other change comes in the blueprint, community health team quality improvement facilitator language in section 7. And so I incorporated Mary Kate's suggestion, but made a few additional changes. So I kind of wanted to show them to you because I think just for readability, it made more sense. So to still have the report about the amounts by which the per person per month payments, can't say it, should be increased. And then instead of to contribute to the goal, I said in furtherance of the goal. And then instead of saying in furtherance of the goal of increasing each plan's or payer spending on primary care to provide comprehensive services, et cetera, I just said in furtherance of the goal of providing additional resources necessary for the delivery of comprehensive primary care services. So it's starting to get a little wordy about contributing to increasing spending. This seemed a bit more straightforward. Right, and it does not take, right, the earlier draft took out that tied to a particular percentage.
Okay.
Does that,
I think
Work
that,
for
I think,
folks?
I hope that works. I think that's probably an improvement.
and I believe that is it. Looked at,
Do we want to leave, just a question for the committee, do we want to leave in of the goal of, or just furtherance of providing additional resources?
I think we need to use the goal in there,
Okay.
moving towards it.
Devin, thank you for being here. Do you want to comment?
Yeah, thanks for having me. Devin Green from the Vermont Association of Hospitals and Health Systems. And just along the lines of the definition, it seems very last minute and it's a very important piece. I'm a little worried about restricting things to, you know, incentive payments based on quality of care. You've talked about global budgets and using sustainable payments to shift things to primary care, which wouldn't necessarily happen if we have to have need for quality incentives in one area to get the payment. I would just like to allow for maximum flexibility or the opportunity to define this over on the House side if we need a definition.
Okay, yeah, no, the discussion that we had earlier was, I asked the question, what is the definition of value-based payment? Because we don't have it, and it's not in statute currently. We don't have to put it into this bill, but I think that having having some level of understanding of what it means when we use it, because it's used all the time. And I'm particularly concerned about, you know, people I'm talking with and explaining things to, and knowing that there is a concrete definition. So Jen, you have tell us again how you developed this definition.
I mean, it was since the time I
Yeah,
left here, and I sent out an APB over YouTube now. Communicated to Robin Lunch, who looked around there. You know, there isn't necessarily a specific one in federal statute that we can find that quickly. So it's kind of a bit cobbled together from other sources. I won't swear that it's a perfect definition either. I think.
Yeah.
I think.
well, you know, and I do think that just hearing Devin's comment, I think maybe it's a good idea if we delete it here, but then we know that this is something important to us that we'd like to have. So let's sit down at some point and maybe we'll put a section in here that directs the stakeholder groups. No. Yeah, but why don't we take it out for now, because otherwise it will become confusing. But also understanding that this is something that we would like to have. This is very important to us as we go forward. And I like this definition, but you know, just seen it for the first time.
I do think Devin has a point about it, that I think there are reasons to be concerned that it inadvertently locks into something
Yeah,
that may not be what is intended.
we don't want to lock it in. Yeah, it shouldn't be locked in. I agree with that. Yeah, okay. Let's do that. Yes.
That being said, I mean, originally it said global budgeting, which was sort of just one thing that we could do, right? Is that, and then this kind of expanded that. But my question is, you know, what do you base the analysis on about the health outcomes, and what is that? So I guess there has to be, I would think that there has to be something a little more concrete, how you determine those health outcomes.
Well, the determination of the health outcomes that involves all the HIV that's in the bill, and looking at the clinical data and doing the analytics on that to see what has worked for our diabetes patients, and so those recommendations.
Maybe this definition needs to have a reference to that process.
Yeah, we can talk about that.
I
Okay,
just took the definition out.
Yeah. Okay, that's good. I think that makes a whole lot of sense. I
Listening to you,
really
listening to that.
appreciate the time that you took to put this together, and the APB that went out, because
It's the handy thing, right?
we need that.
All right, so I do have a clean version now. I've been making the cleanup as we go along. So I can send that to Mary, and all of you, if you would like. Do you want me to send it to you as well, so you can?
Yep. And then Aaron will have to get copies printed out.
And this way, if I get called, my bill is up. Leave you to.
Oh, gosh.
Ever talk on the health board?
No, but sometimes they have questions, and in fact, the reason I was able to come down here is because there was a question for ledge council on the bill before mine, and I had to go find the attorney.
Oh, and do they just take a recess? And I see, okay.
We look in panic and say,
Right. And I sent an email out saying, you know, they're looking for you, but, so it's tough. It's tough when and there isn't a way for me to know what's going on, so I've asked the House Health Care Committee assistant to let me know when the bill comes.
Yeah.
Sorry.
we're pretty good at seeing when we're starting to dig ourselves into a hole and giving us a note.
Sometimes delivery of the note takes longer than
A recess, so.
How many attorneys are there in your office?
18.
You've been here 18 years?
No, there are 18 attorneys. I've been here 15. Nolan and I were just talking, we've been here 15 years. So I think it's getting a little late for us to claim the new card.
Yeah. Just uploaded that, what you sent me, somebody report,
4.3, we
Yeah.
do have it now.
I just uploaded it, take a minute to load.
Okay.
We also have 4.2 up there already.
Oh, and they're starting on me, so email if you need something.
We're on our own.
Where is she going?
To the floor.
We'll go through what we have. Probably do it.
I think she just went through everything.
We've been through it
Yeah.
twice already.
Yeah. Have you been through it? Is it good? Is it okay?
Am I okay? 5 million.
So, right,
Does it add up
the
to 5 million?
budget that,
That's split there.
the budget that Green Mountain Care Board sent is a budget that we've seen in the past, and, but the question is, if we're gonna cover all of the work that we'd like to have done, maybe we need more money. In the meantime, we are only working with what's in there. We're not making all those decisions. So it'll be interesting to see. Is it up? Yeah, it's up.
Yep.
Okay, so we now have draft 4.3 on our webpage for S285. And make sure I have it.
Just 3 drafts, so I'll make sure you look at 4.3.
We each have it. So now, I think we have been through it. Let's just make sure that that definition was removed. It's gone. Okay. So then we've made significant progress on this with the help of the folks who have gotten together, including Green Mountain Care Board, Agency of Human Services, hospitals, and others. Does anyone have a desire to look at any specific section, or? We don't have ledge council. Nolan, from your perspective, as this goes to appropriations, there's a $5 million fiscal note for it, and we've carved that money up in new and unique ways.
Yes.
So appropriations, will be hearing testimony about how funding.
My fiscal note will break those out, so
Yeah.
clear fashion.
Okay, all right. Any discussion? Any motion?
Motion. To move on this 285 version 4.3.
Okay. Further discussion on S285 draft 4.3. Call a roll.
All right. Starting myself, yes. Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy,
Yes.
Senator Lyons.
Yes. But this has been this has been a heavy lift, because there's a lot in the bill. It is not simply understood or explained, but yeah, I think it's such a critical step that our consultants have recommended, Mountain Care Board has recommended, and we've worked very hard on to make improvements. So thank you. This is great. And I guess I'll report it. Thank you, Nolan.
Thank you.
Yes. Thanks, guys.
Are we done?
We can go off.